How is seronegative Rha diagnosed with negative blood tests? Imagine trying to solve a puzzle where some pieces are missing. That's often what diagnosing seronegative rheumatoid arthritis feels like. And like other types of Rha, blood tests for antibodies like rheumatoid factor and anticyclic citrullinated peptide come back negative. This means doctors can't rely solely on blood tests to confirm the diagnosis. Instead, they look at the whole picture. First, they pay close attention to symptoms. Patients often report joint pain, swelling, and stiffness, especially in small joints like those in the hands and feet. Morning stiffness lasting more than half an hour is common. The joints may feel warm, red, and swollen. Sometimes, patients also experience systemic symptoms such as fatigue, muscle aches, or eye dryness. These signs suggest inflammation but aren't specific to Rha alone. Next, imaging studies become very important. X-rays, ultrasounds, or MRIs can reveal joint damage or inflammation that might not be obvious during a physical exam. For example, early signs like joint swelling or erosions can support the diagnosis. These imaging tools help visualize changes in the joints, providing evidence of ongoing inflammation even when blood tests are negative. Inflammatory markers like erythrocyte sedimentation rate and C-reactive protein are often elevated in seronegative Rha. These tests measure the level of inflammation in the body and can indicate active disease. An elevated ESR or CRP supports the presence of inflammation, even if antibody tests are negative. Since symptoms of seronegative Rha overlap with other forms of arthritis and autoimmune diseases, doctors carefully rule out other conditions. They take a detailed medical history, perform thorough physical exams, and may order additional tests to exclude alternative causes of joint symptoms. Rheumatologists also use established classification criteria, such as the 2010 American College of Rheumatology and European League Against Rheumatism guidelines. These criteria consider joint involvement, how long symptoms have lasted, inflammation levels, and imaging findings. Even without positive blood tests, these criteria help confirm the diagnosis based on the overall clinical picture. Early diagnosis is crucial because starting disease-modifying treatments promptly can prevent joint damage and improve quality of life. Since blood tests might not show antibodies, clinicians relying heavily on physical signs, imaging results, and inflammation markers. This comprehensive approach ensures patients receive accurate diagnoses and appropriate care, even when standard antibody tests are negative. In summary, diagnosing seronegative rheumatoid arthritis involves a careful combination of clinical examination, imaging studies, inflammation tests, and ruling out other conditions. It's like putting together a puzzle with some pieces missing, but when all the clues fit, doctors can confidently identify the disease and help patients manage it effectively. Always remember to consult a healthcare professional for personalized advice and diagnosis.